Your body is aging right now, not just in the obvious ways like wrinkles or grey hair, but at the cellular level where damage accumulates silently in your tissues, your blood vessels, your organs, and your brain. And the primary force driving this accelerated aging is something most people have never heard of, even though it's happening inside their bodies every single day. It's called chronic inflammation, and it's one of the most powerful determinants of how fast you age and whether you'll spend your later years in good health or managing multiple chronic diseases. Chronic inflammation is different from the acute inflammation you experience when you cut your finger or sprain your ankle. That type of inflammation is beneficial. It's your immune system responding to injury, clearing out damaged tissue, fighting off infection, and initiating healing. It's intense, it's localized, and it resolves within days or weeks. But chronic inflammation is something else entirely. It's a low-grade inflammatory state that persists for months, years, or even decades. It's not intense enough to cause obvious symptoms. You don't feel it the way you feel acute inflammation. But it's constantly active, generating inflammatory compounds that circulate throughout your body and damage tissues everywhere they go. Scientists now understand that chronic inflammation is the common thread connecting virtually every age-related disease. Heart disease, diabetes, cancer, Alzheimer's disease, arthritis, autoimmune conditions, and even depression are all driven or accelerated by chronic inflammation. The reason these diseases cluster together as people age is that they share a common underlying cause, which is inflammatory damage accumulating over decades. And critically, the rate at which this damage accumulates varies enormously between individuals based on lifestyle factors that are largely within your control. Some people have low levels of chronic inflammation throughout their lives. Their tissues age slowly, their organs maintain function well into old age, they remain physically and mentally capable into their 70s, 80s, and beyond. Other people have high levels of chronic inflammation starting in middle age or even earlier. Their tissues age rapidly, they develop cardiovascular disease, diabetes, or cognitive decline in their 50s or 60s. They spend decades managing chronic conditions and losing functional capacity. The difference between these outcomes often comes down to how much chronic inflammation their daily habits are generating. What makes chronic inflammation particularly insidious is that it's silent. You can have dangerously high levels of inflammation damaging your arteries, accelerating brain aging, and increasing cancer risk without feeling anything wrong. There's no pain, no obvious symptoms, just silent cellular damage accumulating day after day, year after year. By the time symptoms appear, significant damage has already occurred. This is why chronic inflammation is accurately described as a silent killer. It's destroying your health quietly, and most people have no idea it's happening until disease develops. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in the AAN, I've seen what decades of chronic inflammation do to the human body. Patients in their 60s with arteries so damaged by inflammation that they're having heart attacks despite never smoking and maintaining normal cholesterol. People in their 70s with joints destroyed by inflammatory arthritis. People in their 80s with Alzheimer's disease driven by decades of brain inflammation they never knew was happening. These conditions develop over years, but the inflammatory process driving them starts much earlier than most people realize. My goal now is to help people understand what chronic inflammation is, what causes it, how to measure it, and most importantly, how to reduce it before it causes irreversible damage. Because chronic inflammation is one of the few fundamental aging processes that you can actually control through daily choices. You cannot change your genetics, you cannot stop time from passing, but you can dramatically reduce the inflammatory burden your body carries. And in doing so, you can slow biological aging and prevent the diseases that steal healthy years from so many people. For the next few minutes, we're going to talk about chronic inflammation and aging, not vague claims that inflammation is bad, but the specific mechanisms through which inflammation accelerates aging at the cellular level, damages specific organ systems, and increases disease risk across the board. And once you understand these mechanisms, you'll know exactly what you need to do to measure your inflammation levels and bring them down to protect yourself from accelerated aging and premature disease. To understand how chronic inflammation ages you faster, you need to understand what inflammation actually does at the cellular level. Inflammation is fundamentally your immune system's response to threats. When immune cells detect danger, whether that's an infection, an injury, or damaged cells, they release inflammatory molecules called cytokines. These cytokines signal other immune cells to come to the site. They increase blood flow to the area. They make blood vessels more permeable, so immune cells can exit the bloodstream and enter tissues, and they activate processes to destroy pathogens and clear damaged tissue. In acute inflammation, this response is precisely controlled. It's turned on when needed and turned off once the threat is resolved. But in chronic inflammation, the inflammatory response never fully turns off. Your immune system remains in a low-grade activated state, continuously producing inflammatory cytokines even though there's no active infection or injury to resolve. These inflammatory molecules circulate throughout your body, and they have damaging effects on tissues everywhere they go. One of the primary ways chronic inflammation accelerates aging is through oxidative stress. Inflammatory processes generate reactive oxygen species, which are highly reactive molecules that damage cellular components, including DNA, proteins, and lipids. This oxidative damage accumulates over time and impairs cellular function. Your mitochondria, which are the energy-producing factories inside your cells, become less efficient. Your DNA accumulates mutations that can lead to cancer or cellular dysfunction. Your cell membranes become damaged, impairing how cells communicate and transport nutrients. The second mechanism involves telomere shortening. Telomeres are protective caps on the ends of your chromosomes that shorten each time a cell divides. When telomeres become critically short, cells can no longer divide and they become senescent, meaning they stop functioning properly but don't die. These senescent cells accumulate with age, and they themselves produce inflammatory compounds, creating a vicious cycle where inflammation accelerates telomere shortening, which creates more senescent cells, which produce more inflammation. Studies have shown that people with higher levels of chronic inflammation have shorter telomeres and faster biological aging compared to people with lower inflammation. The third mechanism is direct tissue damage. Inflammatory cytokines damage the endothelium, which is the protective layer of cells lining your blood vessels. This endothelial damage is the first step in atherosclerosis and cardiovascular disease. Inflammation damages neurons in your brain, accelerating cognitive decline and increasing dementia risk. It damages the insulin-producing cells in your pancreas, contributing to diabetes. It damages joint cartilage, leading to arthritis. Chronic inflammation is essentially a systemic assault on tissues throughout your body, accelerating the deterioration that we associate with aging. The fourth mechanism involves disrupted cellular signaling. Chronic inflammation interferes with how cells communicate with each other and respond to hormones. It impairs insulin signaling, which leads to insulin resistance and metabolic dysfunction. It disrupts leptin signaling, which affects appetite regulation and contributes to obesity. It impairs growth hormone signaling, which affects muscle maintenance and tissue repair. These disrupted signaling pathways accelerate functional decline and increase disease risk across multiple organ systems. If chronic inflammation is the problem, what causes it? This is where lifestyle factors become critically important. The chronic inflammation that ages you faster is largely driven by behaviors and exposures that are within your control. Understanding these sources allows you to eliminate them and dramatically reduce your inflammatory burden. The first major source is an inflammatory diet, particularly consumption of processed foods and industrial seed oils. Processed foods contain refined carbohydrates that spike blood sugar and generate inflammatory compounds through glycation. They contain emulsifiers and preservatives that damage your gut lining and trigger intestinal inflammation. And they're typically cooked in or contain industrial seed oils like soybean oil, corn oil, and canola oil. These oils are extremely high in omega-6 polyunsaturated fats that are prone to oxidation. When these oxidized fats are consumed and incorporated into your tissues, they generate inflammatory compounds throughout your body. Multiple studies have shown that diets high in processed foods and seed oils are associated with elevated inflammatory markers. People eating these foods have higher levels of C-reactive protein, interleukin-6, and tumor necrosis factor alpha, which are all markers of systemic inflammation. Conversely, diets based on whole unprocessed foods are associated with lower inflammation. The dietary pattern you follow day after day determines your baseline inflammatory state, which accumulates into years or decades of either accelerated or slowed aging. The second major source is excess body fat, particularly visceral fat around your abdomen. Fat tissue is not metabolically inert. It's an active endocrine organ that produces hormones and inflammatory compounds. Visceral fat, in particular, produces large amounts of inflammatory cytokines, including interleukin-6 and tumor necrosis factor alpha. These cytokines circulate throughout your body and contribute to systemic inflammation. This is why obesity is associated with virtually every chronic disease. The excess fat is generating chronic inflammation that damages multiple organ systems simultaneously. The third source is chronic stress and elevated cortisol. Psychological stress activates your sympathetic nervous system and increases production of inflammatory cytokines. Cortisol, which is your primary stress hormone, has complex effects on inflammation. In the short term, cortisol is anti-inflammatory, but chronic elevation of cortisol impairs immune regulation and can actually increase inflammatory cytokine production. People under chronic stress have measurably higher levels of systemic inflammation, which contributes to accelerated aging and increased disease risk. The fourth source is poor sleep quality and sleep deprivation. Sleep is when your body performs maintenance and repair functions, including resolving inflammation from the day. When sleep is inadequate, inflammatory markers rise. Studies have shown that even a single night of poor sleep increases inflammatory cytokines. Chronic sleep deprivation creates a state of persistent low-grade inflammation that affects cardiovascular health, metabolic function, and brain aging. Sleep apnea, which causes repeated oxygen drops during sleep, generates particularly severe inflammation and dramatically accelerates cardiovascular aging. The fifth source is physical inactivity. Sedentary behavior is associated with elevated inflammatory markers. Exercise, conversely, has powerful anti-inflammatory effects. Physical activity reduces inflammatory cytokine production, improves immune regulation, and enhances your body's antioxidant defenses. People who exercise regularly have lower baseline inflammation compared to sedentary individuals, which translates to slower biological aging and lower disease risk. The sixth source is smoking and environmental toxins. Cigarette smoke contains thousands of toxic compounds that directly trigger inflammation throughout the body, particularly in the lungs and cardiovascular system. Other environmental exposures, including air pollution, pesticides, and industrial chemicals, also promote inflammation. While you cannot control all environmental exposures, minimizing them where possible reduces your inflammatory burden. The seventh source is chronic infections and poor gut health. Periodontal disease, which is chronic gum inflammation, increases systemic inflammatory markers and cardiovascular risk. Gut dysbiosis, which is an imbalance in your gut bacterial composition, promotes intestinal inflammation that can become systemic. A damaged gut barrier allows bacterial fragments to enter your bloodstream, triggering immune activation and inflammation throughout your body. Maintaining good oral hygiene and gut health is essential for controlling systemic inflammation. If you're realizing now that chronic inflammation is the underlying force driving most of the diseases you want to avoid as you age, I want you to understand that this knowledge gives you tremendous power. Most people never learn about chronic inflammation until they've already developed disease. But understanding it now means you can take action before irreversible damage occurs. I'm committed to providing you with the science-backed information you need to slow aging and prevent disease rather than just manage symptoms. And I'd really appreciate it if you'd hit that subscribe button to help this content reach more people who need to understand what's actually driving their aging process and what they can do about it. If you get to the end of this video and don't think you learned something important, you can unsubscribe. But if this information is helping you understand the root cause of aging and disease, then stay with me and help spread this message. Hit that subscribe button now, and let's continue with how to measure and reduce your inflammation levels. Given that chronic inflammation is silent and causes no obvious symptoms, the only way to know your inflammatory status is through blood testing. The most widely used and validated test is high-sensitivity C-reactive protein, or hs-CRP. This measures a protein produced by your liver in response to inflammatory signals from elsewhere in your body. When inflammation is elevated anywhere in your system, hs-CRP rises. The test is inexpensive, widely available, and provides critical information about your inflammatory status and cardiovascular risk. Yet most doctors do not order it routinely unless you have specific symptoms or established disease. This is a significant oversight because hs-CRP is one of the best predictors of future cardiovascular events and overall health trajectory. If you have never had your hs-CRP tested, you should request it specifically at your next physical examination. The interpretation of hs-CRP results is straightforward. Levels below 1 mg per litre indicate low inflammation and low cardiovascular risk. This is optimal. Levels between 1 and 3 mg per litre indicate moderate inflammation and moderately elevated risk. Levels above 3 mg per litre indicate high inflammation and significantly elevated risk of cardiovascular events and accelerated aging. Studies have consistently shown that people with hs-CRP above 3 have 2 to 3 times higher risk of heart attack, stroke, and premature death compared to people with levels below 1. Other inflammatory markers can also be measured, including interleukin-6, tumor necrosis factor alpha, and erythrocyte sedimentation rate. But hs-CRP is the most validated and studied marker in relation to aging and disease risk. It is the marker you should focus on measuring and tracking over time as you implement interventions to reduce inflammation. One important note is that hs-CRP can be temporarily elevated during acute infections or illnesses. If your result is high, it should be repeated a few weeks later to confirm that it reflects chronic inflammation rather than a temporary spike from an acute illness. But persistently elevated hs-CRP indicates that chronic inflammation is present and needs to be addressed. Once you understand that chronic inflammation is accelerating your aging and you have measured your levels through hs-CRP testing, the next step is implementing interventions to bring those levels down. The good news is that chronic inflammation responds remarkably well to lifestyle modifications. You can see significant reductions in inflammatory markers within weeks to months of making these changes. The first and most important intervention is dietary modification to eliminate inflammatory foods and emphasize anti-inflammatory foods. Remove processed foods from your diet as much as possible. Eliminate industrial seed oils completely by avoiding fried foods, processed snacks, and restaurant meals cooked in vegetable oils. These oils are the primary dietary source of oxidized inflammatory fats. Replace them with traditional fats like olive oil, butter, ghee, and coconut oil. Eliminate or dramatically reduce refined carbohydrates and sugar. These foods spike blood glucose and generate inflammatory compounds through glycation. They worsen insulin resistance, which itself drives inflammation. Replace processed carbs with vegetables that provide nutrients and fiber without inflammatory effects. Make vegetables the foundation of your diet, filling half your plate with them at every meal. Different colored vegetables provide different antioxidants and phytonutrients that combat oxidative stress and reduce inflammation. Increase your intake of omega-3 fatty acids from fatty fish. Omega-3 fats, particularly EPA and DHA, have powerful anti-inflammatory effects that counterbalance the inflammatory effects of omega-6 fats. Eat fatty fish like salmon, mackerel, sardines, and anchovies at least twice per week, or supplement with high-quality fish oil, providing at least 1 to 2 grams of combined EPA and DHA daily. Studies have shown that higher omega-3 intake is associated with lower inflammatory markers and reduced disease risk. The second intervention is achieving and maintaining a healthy body weight, particularly reducing visceral abdominal fat. Even modest weight loss of 5 to 10% of body weight significantly reduces inflammatory markers in overweight individuals. The reduction in visceral fat directly reduces the source of inflammatory cytokine production. Weight loss through the dietary changes already described, combined with increased physical activity, provides a double benefit of removing inflammatory foods while reducing inflammatory fat tissue. The third intervention is regular physical activity. Exercise has direct anti-inflammatory effects independent of weight loss. It reduces inflammatory cytokine production, improves immune regulation, and enhances antioxidant defenses. You do not need extreme exercise. Moderate intensity activity like brisk walking for 30 minutes most days provides substantial anti-inflammatory benefit. Adding resistance training 2 to 3 times per week further improves metabolic health and reduces inflammation by building muscle mass, which is metabolically active tissue that helps regulate inflammation. The fourth intervention is prioritizing sleep quality. Get 7 to 8 hours of quality sleep every night in a dark, quiet, cool environment. Maintain a consistent sleep schedule. Avoid screens for at least an hour before bed. If you have symptoms of sleep apnea, such as loud snoring or daytime fatigue, despite adequate sleep duration, get evaluated and treated. Improving sleep quality reduces inflammatory markers measurably within weeks. The fifth intervention is stress management through daily practices like meditation, deep breathing, or time in nature. These practices reduce cortisol and lower inflammatory cytokine production. Even brief daily interventions of 10 to 20 minutes provide measurable benefit to inflammatory markers. Stress management is not optional. It is a direct intervention against the inflammatory processes accelerating your aging. The sixth intervention is maintaining good oral hygiene and gut health. Regular dental cleanings and daily flossing reduce periodontal inflammation that can become systemic. Supporting gut health through adequate fiber intake, fermented foods, and avoiding gut-damaging processed foods maintains gut barrier integrity and reduces intestinal inflammation that can spread throughout your body. The seventh intervention is avoiding smoking and minimizing exposure to environmental toxins where possible. Smoking cessation provides rapid and substantial reductions in inflammatory markers. Reducing exposure to air pollution, pesticides, and industrial chemicals through choices about where you live, what products you use, and what foods you eat reduces your toxic burden and inflammatory response. Chronic inflammation is the silent killer, accelerating your aging and driving the development of virtually every age-related disease. It damages tissues throughout your body, shortens telomeres, impairs cellular function, and creates the conditions for heart disease, diabetes, cancer, dementia, and functional decline. The rate at which this inflammatory damage accumulates varies enormously between individuals based on lifestyle factors that are largely within your control. The major sources of chronic inflammation include inflammatory diets, high in processed foods and seed oils, excess body fat, particularly visceral fat, chronic stress, poor sleep, physical inactivity, smoking, and poor gut health. Each of these factors contributes to your total inflammatory burden, which accumulates over decades into either accelerated aging and early disease or slow aging and maintained health into old age. Chronic inflammation can be measured through simple blood testing using high-sensitivity C-reactive protein. This test reveals your inflammatory status and predicts your risk of cardiovascular events and accelerated aging. If you have never had this test, request it. If your levels are elevated, take it as a serious warning that inflammatory damage is accumulating and needs to be addressed before irreversible harm occurs. The interventions to reduce chronic inflammation are the same fundamental lifestyle factors that promote health across all dimensions. Anti-inflammatory diet, emphasizing whole foods and eliminating processed foods and seed oils, maintaining healthy body weight, regular physical activity, quality sleep, active stress management, good oral and gut health. These interventions are not theoretical. They measurably reduce inflammatory markers within weeks to months and translate into slower biological aging, lower disease risk, and more healthy years of life. You cannot eliminate inflammation entirely. It is a normal part of immune function, but you can reduce chronic low-grade inflammation to optimal levels where it is not accelerating your aging or driving disease. The choice to do so is yours, and the time to start is now, before silent inflammatory damage accumulates into irreversible disease. If this video helped you understand that chronic inflammation is the silent killer driving your aging process, and that it can be measured, tracked, and reduced through lifestyle interventions, please hit that subscribe button and share this information with someone who needs to hear it. Most people never learn about chronic inflammation until they have already developed disease. Help me spread this message so more people can address inflammation early when prevention is still possible. Thanks for watching, and I'll see you in the next video.